Oh, it's Paul with All About Neurofeedback again. And today I have Dr. Bibi, who's in the North Houston, Montgomery area, has worked in the wellness industry for well over 10 years, helping people with various issues. And she's doing a great job with clients. And I wanted to get her on to kind of explain a little bit more about herself, how she helps people and the results that she sees. So great to see you, Bibi.
Hi, good to see you, Paul.
You bet. So can you tell us a little bit about your journey that brought you into neurofeedback and specifically what is called microcurrent neurofeedback and just what inspired you to pursue this?
Absolutely, Paul. Well, so my background is in pharmacy. I've been a pharmacist for over 10 years, obviously, helping people, making sure that they're effectively and safely using medication therapy. But over the years, I encountered several people who from the conversations I discovered did not feel empowered in their health and wellness. A lot of them didn't really understand their medication therapy and had questions that I really couldn't answer for them because I didn't have their full, health picture. And I would always obviously refer them back to their doctor, and they would share, that those interactions were very limited. They were not able to, properly ask questions time-wise, there's not enough time. And so that really birthed MyNOW Precision Therapy and Wellness, which is my wellness business here in the Montgomery County area in North Houston. And the purpose behind that is really just overall with the different types of services that I offer, empower people and help them to be great advocates for themselves in terms of their health and wellness, meaning that they have access to information and even alternatives to medication therapy, right? So I'm the pharmacist that's like, hey, yeah, let's use the medication if we need to, and if it helps, as long as it's safe and effective. But let us transition from that to find out what the root cause of the problem is, or just even find out if there are alternative ways to treat the condition or, heal without having to go to medication first. And so that really is, my passion, is what I enjoy doing. That's what clients come to me for, is I'll help them look for these alternatives. Our main buckets of work here at MyNOW involve counseling therapy, because I'm also a licensed professional counselor associate and a licensed chemical dependency counselor. So substance use, substance abuse disorders, help clients work and walk through that and overcome that eventually. And so we have counseling and substance use therapy. We also have microcurrent neurofeedback, which is more the highlight of this conversation. And it's somewhat newer to me, but I've been studying it over the last couple of years. And we just recently started offering that service here at our office. And it's just mind blowing, what it offers, the option that it is, to medication therapy. Now, some of my clients are still on medication, of course, while they're starting this. But what we have found, and which is so remarkable, is that over time, because of the way that this microcurrent neurofeedback works, patients are able to transition off their medication safely, of course, within a few sessions. And so I'd, love to talk some more about it, but I know you have, other questions.
Yeah, that's fantastic. You're uniquely positioned because most neurofeedback providers I speak with, they don't have that kind of background. So, be honest, I'm kind of, in most cases, and I know there's exceptions, but in most cases, I'm kind of anti-medication, right? Just because I've seen so much damage. And it seems like you're kind of like that too, but you're probably, way more careful and sophisticated, obviously, than I am with it. But at the same time, it's brought you to this place, and now you're so uniquely positioned to help people with it because you understand both sides so well, right? Which I think is fantastic,
Yeah, absolutely. No, I completely agree. I'm honored to be able to have, that much that background where, I see from both sides, right?
Yeah.
And yeah, it's just it's one of the best things that my clients appreciate is the fact that I'm able to educate them on, okay, if this is the decision that you've made to go this route, medication wise, these are the consequences, or both positive and negative, of course, side effects and all the things.
Yeah.
But also, if you decide to try, say, a more natural alternative, this is what to expect as well. So that is
Right.
just always that's just always a unique thing that I'm able to offer, my clients.
Right. And I imagine that you've obviously run some people through your microcurrent neurofeedback at this point. Um, so what have you seen for results? Like what have you seen happening?
No, I mean, sometimes I tell people, I say, well, I feel like sometimes I'm even more surprised than my clients at the changes that they're observing and things that they're experiencing, the outcomes as a result of microcurrent neurofeedback. Yeah, so just significant shifts, So essentially the simple way I try to explain it, just because this is my thing, I'm into scientific communications, helping people understand complex scientific concepts in making it more simple, simplified to understand. But yeah, I just say it literally is a jump start. You know how if the battery in a car dies and you jump start that. Essentially, that's what microcurrent neurofeedback is doing. It's like, hey, body, you know what to do, right? So it's jump-starting the brain. The brain is saying, hey, you know what to do when it's time to heal. You just need a, little jump start to remind you, because that is a core belief that I have, and I'm sure many others, in the wellness field do, is that our bodies are designed to heal by themselves. They just need to be supported, right, in the right way, whether it's through nutrition, whether it's through, proper stress management, or just, just less exposure to environmental toxins and things like that. So just several other things that affect how well our bodies function. But when our bodies are well supported, they know how to heal. And so it's a matter of us doing our part to support our bodies as best as possible. And so what microcurrent neurofeedback does is it literally gives your brain a jump start to say, hey, now you need to communicate with the body to tell it, hey, this is what needs to happen. Your blood pressure is high because, hey, you just went through a situation where, that would naturally increase your blood pressure, but it knows how to regulate that and get it back to, a balanced place, or, where it's normal for you. And now it knows how to do it, and it does it effectively. So, and there's so many other body processes that are affected when the brain is optimized. And that's really what microcurrent neurofeedback targets.
Right. So, you kind of look at the brain being the control center for the rest of your body, really the rest of your life, right?
Yeah.
So when it's not operating optimally, you're going to have issues in different areas. So when you look at neurofeedback, it really is about balancing the electrical brain waves of your brain, right? Which is kind of different than the chemical dependent, like the chemical model of, depression medication and that sort of thing. So that's where a big difference is, right?
Yes.
Now, when you talk microcurrent neurofeedback, it's different than traditional neurofeedback. And when people hear that, they're probably a little worried that, oh my God, you're going to shock my brain, right? So can you speak a little bit to that?
Yeah, no, absolutely. And you have a great point there, just taking you back a little bit to your comparison with medication. This is how I describe it. So medication really, it does the work for your body. So it's almost like kind of replacing that functioning of your body. And so when you do stop the medication, your body has to do that work of trying to remember, wait, how do I actually reduce my blood pressure again? How do I do all these things? Because
that's a great way to put it. Yeah.
takes the place of that and does it for you, versus something like more natural alternatives are more so like a jump start, like I've been saying, which microcurrent neurofeedback is more like. So it's like training your body how to remember to do the things that it knows how to do naturally, versus doing it for it, if that makes
Right.
sense. I just wanted to touch on that because that's something.
Yeah, no, that's awesome. Great way to put it.
Yeah, so but yes, you are right. Traditional neurofeedback is pretty different from microcurrent neurofeedback. One of the differences, is just in the amount of currents that's actually passed through the brain. The fact that traditional neurofeedback actually focuses on certain aspects, certain areas of the brain, versus what microcurrent neurofeedback does, which is kind of bathing the entire muscle just above the brain. So it's different even in the application, in the way that, you know, the currents or places that the currents apply. So it's the entire brain versus just certain areas of the brain for traditional neurofeedback. Another major difference is the fact that with microcurrent neurofeedback, I feel like for a lot of, you know, younger kids, you know, who have like, you know, impulsivity type symptoms, it is great because they're not necessarily needed to sit still like with traditional neurofeedback, right? We can have conversations. It's a passive process, and usually, you know, some of my clients even like eat while they're in session, or they're doing other things. You know, we're having conversations. It's not like they have to be in a fixed position, which can be a challenge, you know, for younger kids, or maybe more people who have developmental issues as well. The other thing is, really in as little as 10 to 20 sessions, you start to notice a significant difference that's even borderline sustainable over time, versus with traditional neurofeedback, where you need at least a minimum of 30 or more sessions to start to notice a difference. And so, yeah, one of the key things that we talk about with microcurrent neurofeedback is the fact that just very little is what's needed to see such a huge response. A lot of my clients, within even just the first session, many clients who have not had a good night's sleep in months are able to like really have some good restorative sleep just after the first session. I've seen that multiple times with my clients, and that's just,
and you know, yeah, and we were talking earlier, and you mentioned that you give people a chance to experience it at no cost for their first session, which is pretty neat, because if they come in and then they can see that benefit right away, that's pretty amazing, right?
absolutely.
We'll talk more about that towards the end, but now there's different types of microcurrent neurofeedback, and you use one called lens, right?
Yes, that is right. It's specifically an IASIS device is the name. It's IASIS microcurrent neurofeedback.
Okay. And but it works pretty much the same as what we're talking about. That's just the device of your choice, right?
Exactly. There's several devices
Okay.
in the market, but yeah, that is the one that's specific.
Okay. And just to reiterate, when a client goes through it, they're not actually experiencing electrical shock, right? So I know that's something people wonder about.
Yeah, no, absolutely. No, they're not. And I have had to explain that several times, because everyone's nervous, like, am I gonna feel something? A lot of times people don't even feel like anything. Now they might feel, you know, almost like a relaxing, for lack of a better word, like you know, just like a shift, you know, just feeling like they just, you know, just a change in their atmosphere and change in everything for them that allows them to just kind of relax. And so that's usually the extent to it. Now, some people might, you know, depending on, you know, levels of sensitivity, might feel a little bit, you know, tingling, but throughout the process, we're asking, you know, and checking in with the client to make sure there's, you know, not any overstimulation, because that's the extent to what could happen, is like a, you know, just stimulation. And we're constantly monitoring that throughout the process. But it's not anything that, you know, is dangerous in terms of when you compare it to, like, say, side effects that you could get from, you know, medication therapy.
Right. Okay. So tell me the average process. Like, do you have kind of one way of doing it with each client? So like you combine this and this and this, or is it kind of a little bit more subtle? Like how do you approach that with the client? So they
Well, so
might do neurofeedback, and you might do counseling with them, that kind of thing.
Well, yes, actually, a lot of my clients do a combination. We do talk therapy, and what we found is that it actually even helps significantly improve talk therapy sessions, because what happens over time with microcurrent neurofeedback is that clients are becoming more mindful, more aware even of their, you know, that mind-body connection that we always talk about. You know, it significantly increases. And so there is just a shift and an increase in just their ability to even communicate exactly what's going on in their mind and their emotions. So it definitely helps talk therapy. So yes, we do have combination. Well, some clients will do, like this week we'll do talk, and then the next week we'll do, microcurrent, or even within the same week. But we tailor specifically at MyNOW Wellness, we tailor our sessions, our services to the uniqueness of the person, depending on what's going on with them. So we're looking at them, holistically, what's going on in their life at that time, health wise, and just in every way. And that's what helps us kind of craft what would work best for them. And obviously, we're constantly looking and reviewing and seeing how everything's going to change the protocol or change the program that's needed.
Right. Okay. So when you initially speak with somebody, you do that over Zoom or a phone call kind of thing, right? And to just find out what their situation is. And then the next step is, maybe a complimentary session of neurofeedback, or, you have specific next steps for people. So,
Yes.
right. So when somebody, like if you think about somebody that might be dealing with anxiety, or the child's dealing with ADHD, or they're having, dependency on opiates, so whatever it is, what would you say to them? Because it can be pretty intimidating talking about your problems with somebody, right? So what would you say to them?
Yeah, no, I mean, I usually, a lot of times when clients come to me, they've tried everything, medication therapy, probably several years of counseling, and it's really just been a cycle, and they often feel stuck, like, is there anything that's going to help me? I think the first thing definitely that I've heard from my initial conversations is that after speaking with me, a lot of people feel that hope, like it's not over, there actually is something else I could do. And that's kind of my passion, is just helping people realize that, you're still alive. So there's hope, and there are things that we can discover and things we can partner with you to uncover, to get you to a place of wellness. And so, especially when people have a lot of anxiety about, just life overall, or feeling like they're stuck and then there's no other options. I love the fact that we're able to, just say, hey, look, you've tried everything, you've come this far, and you are so strong for even pursuing another alternative. One of my mentors used to say that the most courageous person, in the room is someone who's prayed multiple times, has not gotten the answer, but prays another time, or at least pursues that, or is still on that quest to find an answer. And so just recognizing that if you're still on this search to find a solution, to a problem that you've been dealing with for a very long time, it seems very overwhelming. The first thing to note is the strength that it takes to still reach out. And so I love to celebrate that about the clients that come to me. That encourages me, because, and that just even spurs me on to do my best to work with them to find, what works best, and to get them the healing that they need.
So Bibi, people, you've been working with people for quite a while in different aspects with their mental health. And now that you've incorporated microcurrent neurofeedback, it's another tool in your toolbox. But in general, what do you think, like, what do you help people with the most with? What kind of conditions or things are you able to help people with?
Well, yeah. So, I mean, really mental health challenges, is probably the bucket word that I would use. But really, a lot of my clients, deal with a lot of anxiety, depression when they come. We have clients who have attention deficit disorders, some on the spectrum, autism spectrum, specifically, but also a lot of clients that I work with and enjoy working with, are clients who have PTSD, so post-traumatic stress disorder, and insomnia, which usually these are symptoms, and found across different mental health challenges across the board.
Right.
So those are significantly most of our clients here. We also have, obviously, genetic testing, and those are still focused on really trying to make sure that people are getting the best therapy, right? Whether it's medication therapy, or whether it's nutrition, right? That they're focusing on to get better. We have specified genetic testing as well, that helps to
Okay.
be more precise with that.
And so even if medications are kind of the way to go for somebody, because I, admit that that is definitely necessary for some. Um, you're doing it right. You're doing the genetic, really digging in there. You're finding out what's going on. You're giving them that informed consent that I think is so important, right?
Yeah.
And so you're doing it right, which I think is awesome too, right? Because, if I was going to go and need something like that, I'd want to be talking to somebody like you, you know?
Absolutely. No, you're absolutely right. I mean, because we have these tools now that can help us to be more precise, right? If I am going to take medication, let's make sure that, this won't cause a major side effect that will make things even worse, right? And
Yeah.
so that's what our pharmacogenetic testing allows for. To have, it's really a tool. I feel like everyone should have it just because you never know, what's going to happen when you're going to need it for an emergency situation. But a doctor is able to look at, that and say, okay, well, this person should not be placed on this class of drugs or this type of medication, just because most likely they'll have a major side effects that could be life-threatening, or maybe they need more of this, a higher dose. So those are the specific details that precision genetic testing offers. So
Okay.
bottom line
So
is,
you have
go ahead.
MyNOW Wellness as your clinic and precision testing. Is that what it's
Yes, so
called?
we offer, that is one of the services that we offer. So
Okay.
we do counseling therapy, like I said, substance abuse therapy. We have the microcurrent neurofeedback. We have genetic testing. Underneath that, there's pharmacogenetic testing and nutri-genetic testing, which is more focused on what kinds of foods do I specifically, need to eat to optimize my entire well-being.
Right, right.
And then we offer medication therapy management. So that's just alongside, just making sure, like, if I do have to be on medication, then am I on the right medication, the right dose? Am I using it the right way? Is it safe and is
Okay.
it effective for me? So that's what.
Okay. So basically, when somebody does the consultation with you, you're kind of going to guide them into where you think they need the most help, right? And
Exactly.
go from there. Okay.
Exactly. And also
Awesome.
work with them for, their goals. Essentially, it's about my client, what they want to achieve. And so I just provide the tools, the education, and obviously my recommendations, but ultimately partner with the clients to make sure they get what they really want.
Okay. Awesome. So, do you have any final thoughts that you want to share that we didn't talk about?
Well, no, I mean, I think we covered, a whole lot. One of the ways,
Yeah.
is just to reach out, it's never too late, is what I like to share with people is, I know you've tried many things, people have tried several things, and there's so much information out there, in our healthcare field. It's inundating, right? But I love to help people sift through all of that and just kind of find exactly what you need. So that's it.
Right. That is awesome. Okay. So underneath this video, whether you watch it on YouTube or, a website or All About Neurofeedback, there'll be a link that goes back to where you'll be able to connect with Bibi or Dr. Bibi, right? And connect with you through a consultation and go from there. So, other than that, we really appreciate your time today. And it was great speaking with you. You gave some very unique insights, especially on the medication side, which I appreciate a lot. Thank you.
Of course, thank you. It's a pleasure to be chatting about something that I'm very passionate about and just sharing it because, a lot of people need to know that there are options, and that's what I love.
Absolutely. Yeah, that's great. Thanks so much.
All right, thank you, Paul.